So in today's session, we'll do the chapter of Diet in Diabetes Mellitus, chapter 19, page number 399. Those who have the new textbook, recent edition, page numbers may slightly vary. Please mention the page number, new page number in the chat box. And if anyone is joining late, please help them out with the topic name or the page numbers. (407) or 406 in new textbook. So diabetes, it is a chronic metabolic disorder. Okay, once you get diabetes, it is for a long term. Okay, and it's a metabolic disorder in which the way how the body metabolizes certain macronutrients and how it is absorbed. Okay, the way how the body has to use glucose. Okay, these all areas are affected when a person is diabetic. Okay, and it's usually high blood glucose level in the blood as well as even in urine. Okay, high glucose level in blood, high glucose level in urine. These all are the classical signs of diabetes. Okay, and slowly there is alteration in carbohydrate, protein, and fat metabolism as well. And why this happen? Because usually it's related to insulin. Okay. Either the insulin is not produced or the cells are not responding to insulin. Okay. Either in these two ways, diabetes can happen. So here you can see in a healthy human being's body, okay, insulin is secreted by the pancreas and cells will take up the glucose because of insulin. Insulin receptors will insulin will go and attach to insulin receptors, and certain channels in the cell membrane will open up for the glucose to enter. Okay, you can see here how insulin is being secreted by the pancreas, this blue ball, how it gets attached to the receptors on cell, and how a channel opens for glucose to enter in. Okay, so there are basically two different types of diabetes, type 1 and type 2. Okay, the causes are different. In type 1 diabetes, pancreas don't produce insulin. There is an absence of insulin. Pancreas fail to produce insulin. There is no insulin produced. Okay, so there is nothing that can open up the pathway for glucose to enter into the cell. Insulin receptors remain empty. Okay, there is no way glucose can enter into the cell. Okay, in type 2 diabetes, insulin is produced in huge numbers. You can see how the amount of healthy insulin produced, the quantity, and the quantity of it produced in type 2. Okay, lots of insulin is produced, but the insulin receptors don't work well. The cells, the insulin receptors fail to acknowledge insulin. So again, the channels are blocked. Okay, glucose wants to enter the cell to be utilized to give energy, but the channels are blocked. Insulin receptors don't allow insulin to attach. Okay, so that is type 2 diabetes. Okay, so these are the two basic types of diabetes. Is it clear to all? And insulin is produced by the beta cells of the pancreas. Okay, pancreas have two different cells. Okay, alpha cells and beta cells from the islets of Langerhans. These are the tissues. Okay, islets of Langerhans are the cluster of cells present in pancreas. Okay, among this cluster, you have beta cell, alpha cell. Beta cell is responsible for producing insulin. Okay, and insulin decreases the blood sugar level because it dumps the sugar in the blood. From the blood, it will dump it into the cells to utilize it for energy. Okay, alpha cells does the opposite. Okay, it releases glucagon. So glucagon will tend to increase the blood sugar level. Okay, it is a type of glucose. It will increase the blood sugar level. Okay, so they work in a conflicting way. So coming to the epidemiology of diabetes, especially in India. Okay, Indians, the body frame of Indians is what we call as skinny fat. Okay, we don't have a large body frame. The frame is still thin, but still inside that thin frame, people are really chubby. Okay, people have a lot of fat deposits, even within a thin, small frame. Okay, people are very chubby. There is a lot of adipose tissue deposits. Okay, in a Indian body, in an average Indian body. Okay, Indians don't have to get overweight or obese to get diabetes. Okay, in West, one has to be overweight or obese to be diabetic or to become pre-diabetic. In India, it's not the case. Okay, because of the history of famines that India had undergone. Okay, even before the British rule, during the British rule, okay, yeah, the various areas, the majority of the continent was pushed towards famines, okay, either climatic ones or man-made famines, okay, because of World War and everything. A major population of India, of the Indian population, had to endure famine. Okay, so these series of famines historically have changed the way how Indian genes behave. Okay, so genetically, Indians are evolved to live on less calories. Okay, because we have a history of famine. Okay, the geography also affects geography, geopolitics also. This is one of the case in which geography and how geopolitics have altered the genes. Okay, in Indian population also that is very evident because we have seen, our ancestors have seen a series of famine, a series of shortage of food. Okay, so Indian genes are meant to work in a certain way that we are supposed to survive on less calories. Okay, so that we don't die out. Okay, but once the globalization took place, once India is started ascending towards development, there was more access to food, different types of food. Okay, uh, the food became more affordable and accessible to each and every group of uh, uh, to each and every income categories as well, upper, middle, lower income. Okay, more reforms came into especially food related reforms. A lot of food related reforms came into India post independence, right? So people in India gained more access to food, okay, which led to overeating. Okay, and that is the reason why this mutation in the Indian genetics, it fired back, okay, in such a way that you don't have to actually get fat, obese, or overweight. Okay, since we are supposed to survive on less calories, if you overeat a slight bit, your body will take up that additional calories, convert it into fat, and put it into your body. Okay, that's why Indians have a skinny fat kind of a body frame. Okay, and that is why we suffer from diabetes even if we are not overweight or obese. Okay, so around 61.3 million people in India live with diabetes, and annually diabetes also is also diabetic along with cardiovascular disorders. Okay, is one of the leading cause of deaths in India. Okay, non-communicable deaths, and number of children with type 1 diabetes is around 70,000. And if you see the scenario, if you compare the race, Indians get diabetes on an average of 10 years earlier than the Western counterparts who are relatively more nutritionally efficient. Okay, the obese, overweight situation is also worse in the Western countries, but we have a worse diabetic scenario. Okay, is it clear to all? So, two major types of diabetes: type 1 diabetes and type 2 diabetes. Type 1 diabetes, it happens when pancreas are unable to produce enough insulin. Okay, and it develops at a young age. It cannot be prevented. And from a young age, kids will be put on insulin therapy because pancreas can't produce a hormone. The hormone has to be given from some or the other way. Okay. So hormonal therapy will start, especially insulin therapy will start at a very young age, that is type 1 diabetes. Okay. And usually majority of type 1 diabetes are autoimmune. Okay. That is your own immunity goes and attacks the specific beta cells in the pancreas that is supposed to produce insulin. Those get damaged and they can't produce insulin. Okay. What happens in type 2 diabetes? It is due to insulin resistance. Okay. And it tends to develop at an older age. It is very rare to find type 2 diabetes in young children. Young adults, yes. A lot of young adults, especially women, are living with insulin resistance. Okay, it can be prevented with lifestyle changes as well. It can be managed with lifestyle modification alone if it is diagnosed early. So in both of this situation, both are diabetes. Their symptoms are quite same. Okay, it is both have the same symptoms, but the pathophysiology is slightly different. The way how diabetes happened is different. Okay, but the outcome, the way how the body will respond is the same. So both the situations, frequent urination, increased thirst, extreme hunger, unintentional weight loss, fatigue, blurred vision, sores and wounds that heal very slowly because high glucose level will not allow wounds to heal immediately. Okay, there is numbness and tingling sensation in hands and feet. Okay, and in both situation, type 1 and type 2 diabetes, you have to do a lot of lifestyle modification. Focus on healthy diet, physical activity, complex carbohydrate diet, low fat diet. Okay, regularly blood sugar level has to be monitored. Okay, and accordingly the dosage of insulin or the dosage of, if the patient is on some oral therapy of anti-diabetic medications, it has to be dose adjusted frequently. Okay, management of stress and other existing health conditions also come under the treatment modality. Okay, so that's about type 1 and type 2 diabetes. So type 1 specific causes, it first is genetics. Okay, type 1 diabetes is also called as juvenile diabetes or insulin dependent diabetes because type 1 diabetes usually affects children first. So genetics plays an important role here. Type 1 diabetes also runs in the family. There is a 50% chance of inheritability of type 1 diabetes. If any one of the parent is suffering from type 1 diabetes, there are high chances, 50% chances that their next generation may also suffer from the same. Infections. A child who has been exposed to a lot of infection from a very young age, okay, recurrent infection, Coxsackie infection, other viral infection, recurrent, okay, at a very regular interval of time, the child was always fighting infection. Okay, that makes the immunity very sensitive, and that's how it turns into an autoimmune disorder. A sensitive immunity can turn into either allergies or autoimmune disorders. Okay, so that's how infections could lead to type 1 diabetes. Acute stress, blood glucose level will rise immediately and at a very high speed, in a very high speed. And in extreme cases, diabetic ketosis or coma also can happen. Okay, especially if it's a senior citizen. Then you have immunological factors. Type 1 diabetes is it's a slow autoimmune disorder. Hyperglycemia is also seen here, definitely. And it's usually hyperglycemia is usually seen when 90% of the beta cells that are supposed to produce insulin are already destroyed by your own immunity. Okay, 90% of healthy beta cells that are supposed to produce insulin get destroyed. Okay, so these are the etiology. Etiology means causes. How does type 1 diabetes take place? Next, type 2 diabetes. Lifestyle also plays a very important role here. People, genetics as well. Okay, but lifestyle, people who are obese, underactive, sedentary, okay, sedentary and they overeat, they have an apple shape. Okay, abdominal fat is situated around the abdomen. Okay, not in the hip area. Those people have a high risk of developing type 2 diabetes. Okay. Lifestyle, it is usually sedentary lifestyle, being overweight, obese, and not being physically active, and taking a high intake of refined grains like white rice. Okay. People who have a staple of white rice along with sedentary activity. Okay. Then genetics, grandparents, parents who suffer from diabetes, the third generation will also have an increased risk of developing diabetes. Then age, it's usually any person, woman or man, about the age of 45. Okay, the risk of developing type 2 diabetes increases. And abdominal fat, I have mentioned earlier, apple-shaped body. Okay, people who have a very poor uh, hip and waist ratio. It means hip is smaller, waist is wider. Okay, those people have a high risk of developing diabetes. And anyone who has a waist circumference, if you take a measuring tape and measure your waistline, okay, if it is more than 90 centimeter, equal to or more than 90 centimeter, there are high chances that you will develop diabetes. Then insulin resistance, it can start as early as teenager as well. Okay, prolonged insulin resistance for a very long years. Okay, more than 3 to 4 years, your body was in a state of insulin resistance. Slowly it will develop into type 2 diabetes. So these are the etiology causes of type 1 and type 2 diabetes. In men and women, there is a slight difference. Okay, that was in another textbook. Women who has a waist circumference, okay, you will all know your jeans size and all. Okay, when you're buying any bottoms, okay, you check the inches. Okay, for women, if your waist inch is more than 33 or 34, if it is more than 33 or 34, your risk of diabetes or cardiovascular diseases will increase. And for men, if your waist circumference is more than 37 or 38 for men, okay, when you're buying jeans or pant or trousers, etc. Okay, when you look for the waist circumference, you look at the waist, that is the size. Okay, so if you're buying a jeans that is, or a trouser that is more than 37 inch, okay, there are high chance that you have an apple shaped body, you have a lot of abdominal fat, and your risk of diabetes or cardiovascular diseases are high. Is it clear to all? Anyone's weight, a woman's waist below 33 inches, okay, a woman's waistline below 33 inches or 34 inches is fine, is healthy from the point of view of diabetes and cardiovascular diseases, generally speaking. Okay. Insulin resistance, as I mentioned, you eat food, but you still feel hungry. Why? You are eating food, you are eating calories, you are giving your body glucose, but the glucose is staying in your blood. Glucose is not entering the cells. Only when the glucose enters the cells produce energy and you feel full. Okay, but you are giving calories, your cells are not taking the glucose, you're giving more calories, your cells are yet not taking the glucose, the cells are tired, you will still feel hungry. Okay, Only when the cells start taking up or start responding to insulin and start listening to insulin and they take up glucose, only that's when you feel full. Okay, that's when you don't feel tired, you have energy. Okay, so this is what insulin resistance is. Coming to the symptoms of diabetes mellitus: hyperglycemia, high levels of blood glucose level. Okay, and also if you're doing a fasting blood glucose test, okay, you don't eat anything for 12 hours, nearly 12 hours. Drink water, that is fine, but don't eat anything. And then you check your blood glucose level. Okay, it should not be more than 100, or it should not be more than 120, or 100 to 120. Okay, if it is below 100, your fasting blood glucose level is below 100, you're normal. Okay, if it is more than 120, it is abnormal. Okay, and then after eating, postprandial blood glucose level, if it is more than 150 and all, okay, there are high chances that either you're pre-diabetic or diabetic. Hyperglycemia means high levels of glucose in the blood. Glycosuria, glucose in urine. Okay, when blood glucose level exceeds the normal glucose level in the urine, okay, usually it is not found around 160 to 180 mg of glucose per ml of your urine. If that is the count, then you are suffering from glycosuria, too much of glucose in urine. Fluid electrolyte imbalance, too much of thirst, too much of urination. Okay, people who are diabetic at night, if you see at least 2 to 3 times, they will have to go to pee and all. Okay, so they are losing a lot of water along with glucose in their urine. They are losing a lot of electrolytes as well. If glucose can escape through your kidneys, it will take some other electrolytes as well. It will not escape alone. Okay, a lot of electrolytes is also lost during the urination. Okay, that is fluid electrolyte imbalance. Then acidosis, the blood pH changes, it becomes more acidic. Okay, why acidosis happens? Now imagine a situation in which your body requires energy and body is not taking glucose for energy. Okay, what will the body do? What is the next option body has? Glucose is supposed to be taken, insulin is trying to push glucose in, but the cells are not responding to insulin. Yeah, the second option is fat. What is fat? Fatty acids. Okay, fat is a macronutrient, but when it enters your intestine, when it is undergoing metabolism, when it is undergoing breakdown, short chain fatty acid, long chain fatty acid, okay, medium chain fatty acid. Okay, so what are fats? Fats are actually, they are acidic in nature. Okay, so when a lot of but fat that is stored in your body is getting broken down into fatty acids, okay, so that so your body can use it. Now your body has a lot of fatty acids being circulated, so automatically fatty acids will make your system more acidic. Okay, now you understand how acidosis takes place. Okay, fatty acids, fat are basically fatty acids. When you break down fats, okay, you get the types of short chain, long chain fatty acids. Okay, so when lipolysis is happening, lipolysis means breakdown of fat is happening in your body to give more energy. Fatty acids are released from the adipose tissues. Okay, and these fatty acids make your blood more acidic in nature. Okay, and also the ketone bodies that are secreted. Okay, when ketone bodies that are secreted because of the lipolysis, increased amount of lipolysis, when the body is utilizing fat, only fat for energy, ketones are the byproduct, and ketones also make your system acidic. Okay, ketone also shifts the pH of your system. Okay, it makes it more acidic in nature. Then polyuria, nocturia, too much of urination, especially at night. Nocturia means too much of urination at night. Okay. Polydipsia, polyphagia. Polydipsia, excessive thirst. They're always thirsty. They try to drink a lot of water, and that lot of water, why body wants a lot of water? Because the glucose levels are quite high in the blood. The body requires more water to dilute it down and to filter out this excessive glucose from the kidneys. Okay, so the body goes into a state of thirst. If you drink more water, your blood will get more diluted, so in a way it is kind of masking the situation. Okay, and polyphagia, you are eating but you're not getting energy. So what will happen? You will still feel hungry. So you will eat a lot, keep on eating a lot. Dehydration because of polyuria, nocturia, too much of urination. Okay, sweating, the body goes into a state of dehydration. Fatigue and weight loss. As I mentioned earlier, when body starts breaking down the adipose tissue, when body starts breaking down the fat to give energy, okay, you're losing weight. You will lose weight. Okay, even though you're eating a lot, but that is not getting stored in your body. Your body is continuously in a state of catabolism, of breaking down that fat, breaking down that protein for survival. Keto diet cannot be recommended for diabetic patients because in keto diet you have to be very specific about the carbohydrate. Okay, you can only eat about 5 to 10% of carbohydrates in your diet. Okay, so you can't put diabetic patients through that. And the long term effect of keto diet, we don't know yet. Then increased excretion of potassium, magnesium, and phosphorus, as I mentioned earlier, when there is too much of urination and too much of glucose in urine. Remember, glucose will not be the only element that will leave your kidney. It will push and take a lot of other electrolytes as well along with it and be urinated out. Okay, so body goes into a state of increased excretion of potassium, magnesium, and phosphorus. So is the symptoms clear to all? So coming to diagnosis, how will you diagnose if somebody is diabetic or not? So as we have seen the symptom of glycosuria, glucose, presence of glucose in high amounts in your urine, that would be a giveaway that the patient would be diabetic. So how do you check if urine has glucose or not? Okay, so there are different tests for that. Benedict's urine test. Okay, glucose specific dipstick tests are done. Okay, there are different types of tests done. In Benedict's test, Benedict's solution is used, and I hope people who are from medical background and all, they would they would have done the Benedict's test somewhere or the other. Okay, so this is the Benedict's test. You use a Benedict solution. Okay, you collect urine sample and put the Benedict solution into the urine sample. I think equal amounts are used. Okay, and after putting the Benedict's test solution, you have to heat the test tube. Okay, the test tube has to be heated. Okay, they're using a test tube holder. You must have done the similar test in chemistry practicals in school time and all. Okay, so using a test tube holder, uh, a test tube that contains urine and urine sample and Benedict solution that is heated for some time, and you wait for the color to change. Okay, and if there is no change in the color, Benedict solution is blue in color naturally. Okay, so when you put it into the urine sample, it automatically turns the urine also blue. And if after heating also there is no change, it means there is no sugar or no glucose in this urine. The person is not diabetic at all. Okay, green, if the color changes into green, very trace amount of sugar, not enough for you to declare them as diabetic. Okay, orange, this could be a pre-diabetic state. Moderate amount of glucose is present in the urine. It could be a pre-diabetic state. Okay, brick red color, if it is turning into red color, it means large amount of sugar is present in this urine sample. The person is definitely diabetic. Okay, so this is one of the glycosuria test. Nowadays, dipstick test is also available. You get certain sticks, okay, which you can just dip into the urine sample. It will change the color, and the key is given in the same package where you have to compare the color, and it will give the reference what is the condition. Okay, and ketone urea to identify if there is ketone bodies in the urine or not. There is too much of ketones also present in the urine along with glucose. Okay, because the body is in a state of ketosis. Body is breaking down fat to give energy. Okay, so ketone bodies are a byproduct of that reaction. Okay, so there is too much of ketone bodies in the system, which your kidneys are desperately trying to get out of your body through urine. Okay, so there is too much of ketones in the urine. So you are checking for ketones in the urine. Okay, so you take a dipstick that comes specifically to check ketone bodies. Take a urine sample, dip the dipstick into that urine sample, and shake off the excess urine. Okay, wait for at least 15 seconds. In 15 seconds, the color of the dipstick will change. Okay, and you have to compare the color of this dipstick on the key that is given on the package. Okay, so based on this key, you can identify if the person is suffering from ketone bodies in urine or not, the patient is diabetic or not. Okay, then you have RBS test, that is random blood sugar test. Any time of the day RBS can be done. Okay, that glucometer is available. Okay, at home also people use glucometer nowadays. So using glucometer any time of the day, okay, you can you can puncture the fingertip, okay, and collect a drop of blood. And if any time of the day, if you have eaten or not eaten, are you fasting, or there has been 2 hours since you ate something, that doesn't matter. If your random blood sugar level is, the answer that you get here is if it is more than 200, okay, 200 mg per deciliter, that is the amount of glucose in the blood any time of the day. If you have more than 200 microgram of glucose in 1 deciliter of your blood sample, it means you are diabetic. Okay, and if you are fasting, it should be less than 120. If you are not fasting, okay, or you have just now ate food, the glucose should be not more than 150. Next, you have glucose tolerance test. So in glucose tolerance test, you will give a sample of glucose for the patient to eat. Okay, you first take the fasting blood sample. The patient will come to your clinic or laboratory with an empty stomach. Okay, fasting for at least 12 hours. Okay, and the patient will come to your laboratory first, and you take the fasting blood sugar sample. Okay, it should be around 100, it should be below 100, that is normal. Okay, you have to first plot the fasting blood sugar level. Okay, then immediately after collecting the fasting blood sugar level, you give the person 75 gram of glucose. Okay, 75 gram of glucose, or in some laboratory they will give you 2 slices of white bread. Okay, equivalent to 75 gram of glucose. So 75 gram of glucose is easy. You can measure it and then put it in a glass of water, around 250 to 300 ml of water. Okay, and give it to the patient to drink. You can squeeze a lemon also, because plain glucose water may make some people nauseated. They don't like the taste of it. So squeeze lemon so it feels like a lemonade. Okay, and after giving this glucose, every half an hour you will collect the blood and urine specimens. Okay, every half an hour you will have to prick your patient. Okay, every half an hour you will not be sure that urine will be there or not, but still at least two times you have to collect the urine. Okay, so after giving 75 gram of glucose, you collect the blood sample every 30 minutes and you keep plotting it on the graph. Okay, after giving the after taking the fasting blood sugar level, give 75 gram of glucose, 30 minutes into it, check the blood sugar level. Okay, after 30 minutes, again plot the blood sugar level. Again, after 30 minutes, plot the blood sugar level. So in 2 hours, at least you will have 4 chances, 3 to 4 chances to plot. Okay, every 30 minutes, you have to plot the graph. Okay, and if the graph comes like this, okay, everything is under 150. Fasting is below 100, and postprandial, if it is below 150, this person is normal. Okay, if the fasting is slightly above 100 but not above 120, it is slightly above 100, postprandial is above 150, slightly above 150. Okay, and it takes a little bit time to come down. This is impaired glucose tolerance. This could be a pre-diabetic case. And a person who is diabetic, okay, fasting blood sugar level is also above 130. Okay, it is more than 100. It is near to 150, so it is above 130. After giving glucose, you can see a spike. It has crossed 200. Your blood glucose level should never be above 200. It should, even after eating food, the blood sugar level should be below 200. Okay, if it is below 150, it is well and good, but it should be below 200. So you can see the spike. A person who is diabetic, fasting was also high. After giving 75 gram of glucose, it has reached its peak, okay, around 250 or 300. Okay, and it is taking time to come down, but even after coming down, it has not come down to the fasting sugar state. Even after 2 hours, the glucose level has not come down where it started. Okay, so this is also diagnosis of diabetes mellitus. Okay, is it clear to all, the glucose tolerance test? Now coming to the treatment. Medical treatment, pharmacological treatment, we will not discuss. Okay. Treatment of diabetes comes in different categories. Just with diet, certain categories of diabetes you can manage just with diet. Okay. Other categories you will require diet along with some hypoglycemic drug like metformin. Metformin is the most common drug. Okay. Diet plus hypoglycemic drug. In some cases, diet, hypoglycemic drug, and insulin. In extreme cases, people who are suffering from diabetes from the past 20, 25 years and all, slowly the pancreas will give up producing insulin. So they will have to use insulin as well. But if your pancreas are functioning fine, Okay, if your pancreas are producing enough quality of insulin, you just require hypoglycemic drug. Okay, repeated urine testing has to be done, glucose monitoring has to be done. Okay, these are the main areas of treatment. In treatment also, in medical treatment, we are looking to give relief from the symptoms. We are trying to reduce the blood glucose level, trying to reduce the glycosuria, ketone bodies in the body. Okay, so these things are the symptomatic management is what we are focusing when it comes to the treatment of diabetes mellitus. Okay. About drugs, you don't have to study how it functions, mechanism of action and all. That is not part of your syllabus. Okay. It's hypoglycemic drug means it reduces the blood glucose level. And it affects the liver. Metformin affects the functions of liver to prevent liver from producing more glucose. That is how it functions. Okay. But the detail in how the drugs function, you don't have to study that. So diet, lot of food exchange lists are available. Diet and insulin, we will discuss that as well. But before that, there is a body weight, ideal body weight that a person should maintain. Okay, easier than the BMI. Okay, Broca index is what we call it. So in men, take their height in centimeters and minus 100. Whatever is the remaining answer, that is the ideal weight for that man. For example, if a man is 175 centimeter, okay, 175 centimeter minus 100, 75. 75 kg is the perfect weight for a person who is 175 centimeter in height. Okay. But for women, you have to subtract 105. Height in centimeters minus 105. For example, a woman who is 170 centimeters, 170 centimeters in height. Okay. What should be her ideal weight? Yes, 65 kg. Okay. That should be her ideal weight, 65 kg. So this is Broca index, very easy index to measure. You can also measure your height in centimeter, and based on your gender, you can subtract the number from the formula and you will get what exactly should be your ideal weight. Okay. Plus or minus 2 kgs is fine. Body mass index, BMI, you all know that, weight in kg divided by height in meter square. Okay. These things will also be tested to give them a ideal diet plan. So coming to dietary management, food exchange list. Those who have the textbook, you can go to the menu planning chapter. Not now. Food exchange list are given in menu planning chapter. Okay. Page numbers may slightly vary, but the chapter is menu planning, and you can use food exchange list. Why food exchange list is used? Even though a person is diabetic, okay, and let's say they have to eat more millets in their diet, does not mean every day you will give them something of ragi. You have to change your millets as well. One day jowar, bajra, one day ragi, one day oats. Okay. So how much ragi, how much oats, how much jowar or bajra will give the same calories, same protein, same energy. Okay. Quantity may slightly vary. So to understand that, food exchange list is used. Okay. So today morning, if I'm having 2 idlis, okay, the amount of protein that I will get from 2 idli, amount of calories I will get from 2 idli. Tomorrow, what should I have that would give me the same macros, okay, same macros, but a different meal. So my menu plan, my weekly menu plan, monthly menu plan seems exciting. It is not monotonous. Okay, that is the use of using food exchange list. And if you search online food exchange list for diabetic patient, okay, you will find a lot of tables in that. You will find a lot of data on that. Okay, more than what is given in the textbook, you will find for practical reasons. And then diet and insulin, especially in type 1 diabetes, juvenile diabetes. Okay, diet therapy, you have to focus a lot on diet. Along with that, you have to make sure that these children are put on insulin therapy and they are regular with their insulin therapies. Okay, and along with the growth and activity, when the child is growing, their activity changes, their lifestyle changes. Along with that, the insulin doses will also vary. Okay, that the endocrinologist will or diabetologist will change it. Okay, the consulting physician will change it based on the growth, age, okay, activity level of the uh, participants. Okay, and dietary measures also, even if you're taking insulin, doesn't mean that you can eat whatever. Okay, dietary measures should complement your insulin therapy. Whatever dietary choices you are making, it should complement your insulin therapy. It should not make it difficult for your insulin therapy to work. Okay, having insulin and eating a lot of bakery items, cakes, that's not how it works. Okay, you have to be very consistent with your diet, and whatever diet you are taking, you have to make sure that it complements your treatment. It enhances the efficiency of your treatment. Okay, then you have Daphne diet. Daphne is dose adjusted for normal eating. Okay, so again, Daphne is especially for people who are on insulin. Okay, and you are adjusting the dose of insulin. Okay, so that you can have a normal life, as normal life as possible, because you don't want your family to sacrifice a lot just because a person is diabetic. One member in the family is diabetic, it does not mean all the other member have to change their diet, because it is tedious for the homemaker, whoever he or she is, to make two separate meals. It would be tedious. So eating the meals, eating the staple food, what they're supposed to eat, and adjusting your insulin dose based on whatever you're eating. That is what we call as dose adjusted for normal eating, Daphne. Okay. So patients can undertake this course. Okay, and whoever is a diabetologist, they will guide the patient what kind of meal they should have, how much insulin dose they have to adjust if they're taking insulin on their own. Okay, the doctor will tell them, if you are in a party, if you're going to some party, if you know you're going to indulge more in rice, wheat, okay, you will eat one extra chapati, or you will have one extra serving of rice. Okay, this is the insulin, extra insulin that you have to take. Okay, if something like this happens, if you're eating a little bit more out of your diet plan, okay, this is what you have to, your insulin has to be adjusted. Just give me a moment, 1 second. So usually patients who are on insulin is also there are different types of insulin. Okay, long acting, short acting. Short acting insulin will give you immediate result, but it will not last long. Long acting insulin, once you take it, it has a it will slowly secrete insulin at a very slow rate, and it will have effect on your blood glucose level at a longer period of time. Okay, daily, once a day you may have to take long acting insulin. If it is short acting, maybe how many times you're eating your meal, that many time you have to take insulin, so that is short acting insulin. Okay, so based on the type of insulin you are taking, especially short acting insulin, you have to be more careful with the timings and all. Okay, the quality of calories, carbohydrates, okay, that should also match the insulin that you are given. Okay, so to study all that, to make a comparison for how many calories you're eating and what type of insulin you should take, These all comes under Daphne diet. Okay, this is not to be practiced by a dietitian or a nutritionist. These Daphne diet, these principles and all is practiced by a diabetologist. Okay, they undergo tremendous training in this category. Okay, you just need to know that you should just have the awareness of Daphne. Okay, and the main reason for following this Daphne diet is to make diabetes as normal as possible. Like it's diabetes is it's not normal, but living with diabetes, okay, people who are living with diabetes, they should not feel their life and their choices are very tedious. Okay, they should also have an equal access to a food, even if it is complex carbohydrates. Okay, the choice of having that food. Is it clear to all about Daphne diet? So coming to the nutritional requirements, energy 25 kilocalories per kg body weight is the target. Again, it depends. Okay, depends on the body weight, height, estimation, goals. Okay, if the person is not overweight, it's not obese, then 25 kilocalories per kg body weight could be fine. But if the person is also looking for weight management goals, okay, you may have to reduce the calorie a little bit more. So it's very subjective. Generally, we can say 25 kilocalories per kg body weight. Carbohydrate, 45 to 60% of total calories should be of carbohydrates, not more than that, not more than 60%. Okay, if you stay at 45 to 50, that is well and good. Okay, 50% of your diet should be of carbohydrates, remaining could be of protein and fat, but don't overdo with carbohydrates. And that too, specific type of carbohydrates. Okay, resistant starches, polysaccharides, that is fiber. Okay, complex carbohydrates, these are the best option. Carbohydrates that are high fiber and they have low glycemic index. Low glycemic index means once you have it, it will not shoot up your blood glucose level. At a very slow pace, your blood glucose level will rise. Okay, that should be the target here. And also the cereals that majority of the Indian diet is based on, you have to control that as well. Avoid simple sugar. Only complex carbohydrate should be included in the diet. High protein diet except in renal disorders. Okay, if even if the person is underweight, you can have more complex carbohydrate. Okay, you can have at least 60% of complex carbohydrate, but focus more on proteins and fat intake if you're underweight. Okay, high protein diet, especially if you don't have any kidney disorders, high protein diet. If you have kidney disorders, protein intake is very controlled. Okay, you have to control your protein intake, otherwise your creatine levels, urea levels will be out of whack. Okay, so high protein diet except in renal disorders. Fat, 20 to 25 gram of visible fat, it's on the lower side. Okay, 20 to 25 gram of visible fat, and reduce the consumption of LDL like ghee, butter, coconut oil. Okay, reduce the consumption of that. HDL fat should be used. Have more nuts, seeds, cold pressed oils, fatty fish. Okay, omega-3 fatty acid should be there in the diet. You can use blended vegetable oils also. Blended vegetable oil, they already come in a format of specific ratios of omega fatty acid and omega-6 fatty acid. So use blended vegetable oils. Olive oil is an example of HDL. Olive oil, all vegetable oils, mustard oil, olive oil, sunflower oil. Okay, these all are HDL sources. Less than 1000 kilocalorie, 1200 kilocalories, you will require micronutrient supplementation. If you're eating less than 1200 kilocalories, you will require micronutrient supplementation. Anyone, not just diabetic, but anyone who's eating less than 1200 or 1500 kilocalories per day, you will require vitamin and mineral supplementation. Okay, you have to take supplements. Soluble fiber, 20 to 25 gram per day, compulsory. You can take isabgol, that is psyllium husk. If you check online, this new Flakes, that is the name of the brand. Okay, something very similar you can find. Flakes, you can get it from Amazon India. Okay, you can search about it. This is like methi seeds, the flakes of methi seeds. Okay, methi seeds after it is used for other purposes. Okay, when you grind it, whatever flakes remain, it is dried flakes. Okay, you can add flakes on dal, chawal, whatever you're eating, or just mix it with water and gulp it down. Okay, that increases the fiber content of your food. It is high protein, high in fiber, low on calories, and fenugreek is a best supplement for uh, diabetic patients. Okay, it can control your glucose levels. So I have typed the name in the chat box, Fenuflakes. You can try that as well. Even if you're looking for weight loss or weight maintenance, Fenuflakes you can incorporate in your diet. If you just get one bottle and use one scoop on a daily basis, it will run for an entire month for an individual use. Okay. So that will solve a lot of your fiber problem. Isabgol and Fenuflakes, these kind of fiber supplementations on a daily basis you can take. Okay. Yeah, you can soak fenugreek also on a daily basis. Make a fenugreek tea and drink it. That is boil water, put fenugreek in it, let the water cool down. Okay, and then have that. So yeah, fenugreek, methi seeds, diabetes, it has a, 1 second. So fenugreek methi seeds, good for diabetes. Okay, it contains a specialized type of soluble fiber called galactomannan that also slows the absorption of glucose in the intestine. So consuming just 5 grams or 5 to 10 grams of fenugreek on a daily basis on empty stomach. Okay, that can also reduce your blood sugar level effectively. So fenugreek is really good for diabetes. Add more, even if you just use methi powder. Okay, ground powder of methi. After cooking, just sprinkle some additional methi on the serving of a diabetic person in your family. Okay, that can also effectively control the blood glucose level. Okay. Artificial sweeteners, we don't recommend. Okay, don't be dependent on any form of artificial sweeteners. Stevia is also fine, but don't be dependent on stevia in the long run. They can also cause addictions. Okay, just like sugar, artificial sweeteners can also cause addictions. There was a study done on mice. Okay, mice was given cocaine and artificial sweetener. Two sets of mice. Okay, they were given cocaine and artificial sweetener for a brief period of time. Okay, and after certain after the after stopping it for some amount of time, and when they were reintroduced, the mice went for the artificial sweetener, but not for the cocaine. Okay, so that's the kind of addiction artificial sweeteners can cause. And aspartame is now kind of banned. It is also called as carcinogen. Aspartame can cause cancer, certain forms of cancer. So avoid it. Stevia is one of the safest ones. Stevia and monk fruit. Okay, stevia and monk fruit is the only one. Yeah, non-diabetics can also use fenugreeks. Okay, if you know that you're not meeting your fiber requirement, if you're not having enough fruits, raw fruits and vegetables in your diet on a daily basis, incorporate fenugreeks. Okay, there is no incorporate isabgol, psyllium husk, or fenugreeks, whatever you wish. Okay. So don't be addicted. Artificial sweeteners are an option occasionally. Keep it occasional. Okay, artificial sweeteners should not be a habit. No, fenugreek is not a replacement of fenugreek. Okay, fenugreek seeds definitely have more galactomannan. Fenugreek is the fiber content of the fenugreek. So glycemic index, certain food come under the category of low glycemic index. Certain food have high glycemic index. What is this low and high? When you eat certain food, immediately your blood glucose level will spike. Okay, those groups of food come under high glycemic index food. Okay, certain food when you eat very slowly, they will rise your blood glucose level. They come under low glycemic index. Okay. So low, medium, and high glycemic index food, this is the categories. You can take a screenshot of it. Your numbers are given. Numbers are given. Any food that has a score of more than 70, you have to avoid it as much as possible in a diabetic patient's diet. Any food that is less than 55, those are the best options for diabetic. Dietary guidelines, you can check the dietary guidelines, just read through it. It is something that we already know, most of the dietary guidelines that are mentioned. Okay, check the broca index of the person, give them their ideal body weight, and if they are obese or overweight, if they are not around their ideal body weight, give them weight management tips as well. Okay, and weight management tips and diabetes control tips are one and the same. Whatever diabetes control tips you give to a person, that automatically becomes a weight loss diet. Okay, it will reduce the weight. And if the person is overweight, when you do the broca index, if the person is overweight, 20 kilocalories per kg should be the target. Ideal weight, 25 or 30 kilocalories. And if the person is underweight, 40 kilocalories per kg. Okay, that should be that is how you have to prepare the diet plan. Certain fruits that you can give to the to diabetics are avocado, muskmelon, gooseberry, watermelon, guava, pineapple. Okay, apple. 55 to 60% of calories can come from carbohydrate, 15 to 20% from protein, and 15 to 20% from fat. Focus on a high protein diet. Focus on a high protein diet. Non-vegetarian food are not rich in carbohydrate. Non-vegetarian food is rich in protein. The content of carbohydrate in any non-vegetarian source of food is less than 5%. Non-vegetarian food is all about protein. Chicken is all about protein. Eggs are protein. Okay, you don't find carbohydrates there. Less than 1% or 2%. Okay, negligible. Simple sugars you have to restrict. Soluble fiber like uh, legumes, whole grain, fenugreek seeds should be added. Polyunsaturated fatty acids like vegetable oils, sunflower oil, groundnut oil, gingerly oil, sesame seed oil, corn oil, olive oil. Okay. Fish and chicken are more preferred than red meat. Focus more on fish and chicken if you are a non-vegetarian. Fried food you have to avoid. Vitamin and mineral supplement has to be given. Short and frequent meals on a timetable. Schedule the meal properly and make sure the patient follows this schedule. Okay. Majority of the people in India are non-vegetarians. But even if you are a non-vegetarian, your meal is, if you're an Indian, your meal is largely plant-based. Okay. If I ask a general question to the class that even if you're a non-vegetarian, on a daily basis, do you eat non-veg? Or if you divide your meal in veg and non-veg on a weekly basis, what is more in your plate? Is it vegetarian meals or non-vegetarian meals? What would be the answer? It is vegetarian meals. Indian diet, Indian cuisine, okay, it is predominantly plant-based. But 70% of Indians, 60 to 70% of Indians are non-vegetarians. But even under that 70% of non-vegetarians, you still have people, majority of them are still following a plant-based diet. Okay. There are some families who will only eat non-vegetarian food outside. They don't bring it home. So at home, what they're cooking? They're cooking only plant-based meal. Okay. Some families don't allow to even eat egg inside, but when they go out, they enjoy it. Okay. So it's like that. It's the non-vegetarians also come in different spectrum when it comes to Indian population. Non-vegetarians are a spectrum. Okay. You have egg eating vegetarians, or just fish eating vegetarians. Okay, there are different spectrum of vegetarianism. So dietary guidelines, there are many points, just read through it. That is just for your knowledge sake. Okay, majority of the points you know already. This is about the glycemic index versus glycemic load chart. You can take a snapshot of this. About fruits, different fruits. So based on the glycemic index and glycemic load, whichever has the low glycemic index, those are the best foods for diabetic patients. Glycemic index is rank, glycemic load is the quantity. Okay. For example, watermelon, the glycemic index is 72. It will not change. Okay. It will not change. Glycemic index will not change. But do you think there is a difference if I have one bowl of watermelon and two bowls of watermelon? Do you think there is a difference? One bowl of watermelon, let's say 100 gram of watermelon and 200 gram of watermelon, are they both the same? 100 gram of watermelon and 200 gram of watermelon, they're not the same. That is glycemic load. Like glycemic load is about the quantity, how much. Okay. Glycemic index is just the rank. It will never change. From the time we got the glycemic index formula till today, the glycemic index of all these fruits are the same. But how much are you consuming? How much is the quantity that you have consumed? That also matters. Portion sizes matters. That is where glycemic load comes into play. Okay. So physical activity for diabetic patients, avoid hyperglycemia and hypoglycemia, avoid physical activity. If you know your blood glucose levels are too low, don't do anything vigorous. If you have high blood sugar level, again, don't do anything that is too vigorous. Okay. 150 minutes of exercise per week. You can spread it according to your schedule. Okay. That is fine. Exercising right before or shortly after the meal is best option. Shortly after the meal will be much better if type 2 diabetes or insulin resistance is present, because soon after, if you have your meal and when you're moving around, okay, it makes your body cells to respond to glucose in a better way. Okay. Movement after having some food, that will encourage your cells to respond to glucose. Moderate intensity exercises, aerobic exercises are preferred, like cycling, brisk walking, swimming, okay, gardening, taking a dog for a walk, okay, yoga. These all are moderate intensity aerobic exercises. Coming to the complications of diabetes, hypoglycemia, as I mentioned, it can be life-threatening. Okay, hypoglycemia can take a patient into a comatose stage, and from it can lead to death as well, because in cases of hypoglycemia, when the brain does not get glucose, it can shut down. Okay, brain, the central nervous system can shut down. Okay. Ketoacidosis, too much of keto bodies in the in your system. Okay, that would lead to low blood pressure, not able to breathe properly. Okay, and that could also lead to coma. Infections, when blood sugar levels are quite high, if you even catch a small infection, it is difficult for you. Am I audible? Is my screen visible? So infections, when the blood glucose levels are chronically high, okay, it's difficult for your immunity to deal with infections. Okay. Cataract and retinopathy, slowly, when the blood glucose levels are high, it is inflammatory in nature, and inflammation will eat up the cells. Okay, eat up the healthy cells. So cataract and retinopathy, neuropathy, nephropathy, okay, damage to retina, damage to neurons, damage to kidneys, slowly it will follow. Okay. Heart diseases are also very common, cardiovascular diseases. If somebody has diabetes, the risk of heart diseases, kidney diseases, okay, it increases by threefold. Nephropathy, as I mentioned, high blood glucose levels, kidneys are exhausted. Kidneys become exhausted, taking out additional glucose from your system. Okay, and this glucose also gets stuck in the nephrons, and it will lead to nephropathy. It will cause irritation, inflammation, damage the kidney, eat the kidney from inside. Okay, so it leads to nephropathy. And diabetes in pregnancy, there is a pregestational diabetes. It means woman who already has diabetes gets pregnant. Okay, this could be a type 1 diabetes from childhood. A girl is suffering from diabetes and she gets pregnant. That is pregestational diabetes. Or in adulthood, a woman got diabetes, okay, or insulin resistance led to diabetes. She got married and she got pregnant and all that goes to pregestational diabetes. Complications will be there, okay. And then there is gestational diabetes. This woman didn't have diabetes at all before getting pregnant. But as soon as she got pregnant, diabetes came. And after delivery, after giving birth, diabetes went off. So that 9 months, okay, those 3 trimesters, the woman was suffering from diabetes. But before it and after the trimester, after birth, after labor, there is no diabetes. But her risk of developing diabetes in the future is high. Okay, any woman who had gestational diabetes, the risk of developing diabetes in the future is high. So about alcohol, avoid alcohol. Significantly increases your blood glucose level. If there is any diabetic person who is alcoholic or who consumes alcohol, try to avoid. It can negatively interact with diabetes medications as well, like metformin. And always test your blood sugar level when drinking. If your blood sugar level is normal after medications and so alcoholism, using alcohol once you are diabetic should not be used. Okay, limit drinking as much as possible. Never drink when you know your blood sugar levels are high, it is not under control. Don't encourage alcoholism. Never drink on empty stomach. So dietary supplements, as I mentioned earlier, fenugreek seeds is the best dietary supplement. Cinnamon powder as well, cinnamon tea, fenugreek tea, bitter gourd, okay, bitter gourd juices, full of antioxidant, anti-inflammatory properties. Aloe vera juice, aloe vera, gurumad powder, the Ayurvedic supplement to control diabetes. So that's about today's session on diabetes. You can read the details in